Hey guys, I'm Dr. Lanford with Keowee Smiles. Today I want to show you a fun case that we did here with one of our patients doing cosmetic dentistry. In this case we did full crowns on this patient. The reason for that, there's a few different options as far as cosmetic dentistry, but the full crowns are a good option when there's a large amount of cavities and decay that we need to take care of before we do the final cosmetic result. So you can see this patient here, she's got some discoloration, a couple of existing crowns, as far as probably some cavities kind of in between these teeth that we can't see just on this picture alone. But what the crown does is, this is an example of existing crowns, but these are actually natural teeth here. But what the crown does is we actually cut the tooth down to a very kind of smaller version of itself. And then the crown is actually made in a lab. You pick the shade, you can change the shape, you can straighten the teeth out if there's any crowding, or in her case, this gap here, you can kind of fix all that. The lab makes kind of the final result that cleans out the cavities and gives you a nice aesthetic result. So we'll show you. And this was the final result. In her case, we did actually 10 crowns across from all the way back here to these premolars on each side. Now, as far as how many you do, a lot of that depends on the smile line. In her case, you know, you can see almost all the way back to her molars and her smile line, so more crowns was better for her. You know, if your smile line is a lot smaller, then you may only need from canine to canine, but in her case, we did all the way back to the premolars, which was a really nice result for her. You can see these are the 2 crowns she had originally. These are replaced to kind of match everything else, closed in the gaps, took care of the cavities, the staining, all that in, you know, kind of one fell swoop. And so this was her before we did any work. You can see the gaps, some crowding and staining, and then the after, a huge difference. A really nice case there for that patient.